Okay, so this is chapters 19, 20, and 21 for CNA. You should probably open up this PowerPoints on Google Classroom and then follow along. This should be on YouTube video link for you. So it's chapters 19, 20, and 21 on CNA. We're going to start off with chapter 19 here, moving the patient or moving the person. This first slide here talks about safely moving the patient. During these and other tasks, you should also must use your body correctly. So you need to use good body mechanics that we talked about in last week's lecture when turning and repositioning patients, moving patients in bed, and so forth. Okay. So with preventing work-related injuries, like I said, you should practice good body mechanics. You should be trying to prevent them at all times. So you should minimize all manual lifting. So using a transfer device or lift for patients is going to be the most ideal situation. You should also, during these times, treat others with respect and dignity, keep patients in good body alignment, and use pillows and other devices to, position the patient. To safely move the patient, the nurse and the healthcare team need to determine whether the patient is independent or like they could help you in the move, or if they're going to need complete assistance. So the amount of assistance that is needed, what procedure to use for it, what equipment is needed, all beforehand are going to be important and included in the care plan. For those patients that are weak or unconscious or paralyzed or in casts, they are definitely going to need help being moved in bed. If you're seeing a patient that is called like a code 4 or total dependent patient, that means that we're going to be using things like a mechanical lift or friction reducing devices and at least or a minimum of 2 staff members. With code 3, they're going to need a lot of assistance, but not quite a full assistance. We also might use a mechanical lift on them or have friction reducing devices and at least 2 staff members as well. If the patient weighs less than 200 pounds, 2 to 3 staff members is usually, and a friction reducing device is the most ideal situation. If the person weighs more than 200 pounds, at least 3 staff members and a friction reducing device. So with moving the patient in bed, one of the big things that can happen is skin tears and skin breakdown. So you need to protect the patient's skin during these procedures. Protecting them is going to be very important. Friction is what is caused, and it is the rubbing of one surface against another. Shearing is when the skin sticks to a surface while muscles slide in the direction the body is moving. You should reduce friction and shearing when moving the patient by rolling them in bed, by using those turn pads, and so forth. Also, so when raising the patient's head and shoulders, you should raise the person's head and shoulders by easily and safely by locking your arms with the person. So you're essentially moving your arm underneath their arm and moving their upper part of their body like this, but you're putting your arm up and underneath their shoulder. You can see that in pictures A, B, and C on these slides with raising the person's head and shoulders. Do not just pull on their arms or shoulders. You're going to pull them out of socket and so forth. It is also best to have help with older patients and those who are hard or heavy to move, just as I have said before. The next picture is going to be 2 people raising the head of the bed or the patient up. So each one of you puts an arm underneath the patient's arm. Count the count of 3, 1, 2, 3. Hold the patient up, give them their drink or their medication, whatever it may be, or raise their head of their bed up as well. With completely moving them up in bed, we actually practiced this last week with a turn pad or a chucks or whatever you want to call it, but the person needs to be moved up in the bed for good alignment and comfort. You can sometimes move light wet adults up in bed alone, but we really, with the help of a trapeze, but we really encourage you to have at least 1 or 2 or more staff members, So you should always protect the patient and yourself from injury during this time. If you look in the middle picture here, that is what we did last week. We rolled up the sides of the turn pad, got as close to, and then we communicated what we were going to be doing. So on the count of 3, 1, 2, 3, lift up, and using lots and lots of muscles, even if you think you don't have them. So moving the patient up in bed with an assistive device The person is going to be moved more evenly. The shearing and friction, the shearing and friction are going to be reduced, and at least 2 staff members are needed for this procedure. This procedure is going to be used for most patients and residents. Anytime we can decrease our backload and so forth, that's going to be helpful. Also, for any patients recovering from spinal cord injuries or spinal cord surgery as well. If we need to move a patient to the side of the bed, you are going to move the patient to the side of the bed. You're going to use this for repositioning purposes or care procedures before turning them. And then if you just reach to the limit that you need to reach over the person. One method involves of turning the patient to the side of the bed is going to involve moving the patient in segments. So with at least one coworker, you could also use a mechanical lift or assist device for older patients or patients with arthritis that are going to be hurt easily, or for patients recovering from spinal cord injuries as well. Using an assist device every single time, no matter what the scenario is going to decrease pain and skin damage and decrease injury to bones, joints, and the spinal cord. So pictures A, B, and C on the next slide are going to be telling you how to do the one-person maneuver. So you move the top part of the person's body over, then come and move the side, or the middle, excuse me, and then lastly their feet and their legs. Again, it would be really, really helpful for you to be following along on these slides on each chapter on Google Classroom. Continuing on here with turning the patient all the way over and keeping them in that turned position. We are turning patients onto their sides to help prevent complications from bed rest. Those skin breakdown, those big problems, bed sores and so forth can be prevented. Also, for any certain procedures or care measures like peri-care or anything like that, we're going to be having to turn the patient as well. The patient is going to be turned towards you or away from you, to their left or to their right. It all depends on the situation and the patient's condition, which way you're going to turn them. After turning the position, you should put them in good alignment. So you're going to use pillows to support the person in the side lying position. Lots of pillows, remember, from last week's lab. So next up is going to be pictures of that, of turning the patient to one side or another. A big thing that we need to work on from last week, and I didn't reiterate to you, was that we need to actually get the patient to the opposite side of the bed first, so that they're not rolling onto the floor and so forth, so that we have plenty of room to get them turned over. Next up is going to be a video. If it allows you to play, that's just fine. I would encourage you to watch that sometime, and it is on YouTube. It's called Moving a Patient Up in Bed with a 2-Person Assist. So the next slide is about log rolling a patient. Log rolling is turning the patient as a unit in alignment, all in one motion. This is really, really helpful if a patient is recovering from a hip fracture with a spinal cord injury. They have to move in one movement, not the top, the bottom, and so forth. So they need to be log rolled or moved just like a log, all in one movement. The person could also have arthritic spine or knees, and this would be a reason for it. You are trying to keep their spine straight in this procedure. For the next procedure, sitting on the side of the bed, this is also called dangling on documentation. The patients and the residents need to sit on the side of the bed for many different reasons. One may just be to eat breakfast. One may be that they just need to get out of bed. Okay. While dangling the legs, the patients can do cough and deep breathing exercises. They can move their legs back and forth in circles. And 2 staff members may be needed for this as well. 2 staff members may be needed because the patient with balance and coordination problems may need support, or if dizziness or fainting occurs, you need to be able to lay the patient back down. So the next step slide is going to be moving the patient to the side of the bed or dangling. And you need to pay attention to that. Repositioning in a chair or wheelchair. This is going to be for good alignment and safety. The person's back and buttocks must be against the back of the chair. You should follow the nurse's directions and the care plan for the best way to reposition a person in a chair or wheelchair. Do not pull the person from behind the chair or wheelchair. Some people can still help with repositioning, and you need to let them do so. Others can need complete help. And if they need help with repositioning, you should also use a mechanical lift. Okay, sorry for the pauses. So for repositioning in a chair or wheelchair, you should also make sure, again, that the patient has good alignment and safety. You should make sure that the patient's back and buttocks must be against the back of the chair. You don't want them slouched down, otherwise they will fall out. You should also follow the nurse's directions and the care plan and the best way to reposition them in the wheelchair or chair. Never pull them from behind. You can ask additional people to help. And then if people cannot help with repositioning, then you should for sure use a mechanical lift. Next up, this is going to be a picture of them using a couple different devices on the wheelchair there. That person is just using a gait belt. On the first picture there, they're using a mechanical lift or a lift device with a pad underneath that patient. Next up, there's a video. It is called CNA Essential Skills Position Client on Side, and it looks like it's going to play for you all. So please play that on your own laptops. It's called Moving in Bed and Turning Patient Away from You. All right, so this is the end of Chapter 19. I'm going to move on to Chapter 20 now. Okay, transferring the patient, these chairs are rolling. Transferring the patient in bed, or transferring the patient. Chapter 20. So during other tasks and any time you're transferring a patient, you must use your body correctly, okay? This includes transferring patients to and from beds, chairs, wheelchairs, stretchers, and toilets as well. Wheelchairs and stretcher safety. Wheelchairs are going to be useful for people who cannot walk, of course, or who have severe problems walking. The person can use the hand rims on the wheelchair or on their feet. The person using their hand, chin, mouth, or other controls on a motorized wheelchair. And then another person using the hand grips, push handles on their wheelchair as well. Also, stretchers are going to be used to transport patients from other areas, and that's what you're going to think of most commonly, like in a hospital and so forth. The next kind of transfer is going to be a stand and pivot transfer. We're going to do this one quite a bit with our patients, like in real life at clinical. Some patients are able to stand and pivot, and this is very, very helpful because typically it's just a one-person assist. Use this kind of transfer when the person's legs are strong enough to bear some or all of their own weight. Also, if the patient is cooperative and can follow directions easily, or if the person can assist with the transfer. Next up is going to be the bed to chair or wheelchair transfers. Safety is very, very important for this. Safety is important for the chair, the wheelchair, the commode, and the shower chair transfers always. You should help the patient get out of the bed on their strong side. If the left side is weak and then the right side is strong, get the person out of the right side of the bed. If in transferring, you should always move the strong side first. Next up is going to be some pictures of us helping the patient move back or sitting back in the chair. Please look through those. And then the next slide is going to be transferring the person from the toilet. So using the bathroom for elimination promotes dignity, self-esteem, and independence. It also provides more of a private environment rather than using the bedpan, the urinal, or the bedside commode. Trust me, you want to go to your own privacy to the bathroom. However, getting to the toilet is hard for the patients who use wheelchairs. There's a video, and it looks like, again, like it's going to work. So please watch that wheelchair to toilet transfer. After wheelchair to toilet transfer is going to be lateral transfers. A lateral transfer is when you're going to move a patient between two horizontal surfaces. The person slides from one surface to another. A transfer from a bed to a stretcher is going to be an example. And you need to make sure and protect the skin during these lateral transfers. This is when we're going to use those friction reducing devices to protect the skin from friction during lateral transfers or transfers like this. So that's going to be the number one priority. A friction-reducing device is going to be used for transfers to and from the stretchers. At least 2 or 3 staff are going to be needed for a safe transfer. Again, if the person weighs less than 200 pounds, a transfer device plus 2 people is probably going to be okay. But if a person weighs more than 200 pounds, a transfer device plus at least 3 people is going to be really essential. So next slide, it says transfer, and then it shows an example of a transfer board from a chair to a bed. These are very helpful. And then it's showing you how to transfer to a stretcher with 2 people, with actually 3 people. Next picture, picture A, on the next slide is going to show you a stand lift, or a set to stand lift, which is what we practiced with last week, and then a mechanical lift in the next 2 pictures. Using a bariatric stretcher, you should check for an EC or an expanded capacity sticker and the weight limit. This is very important for you to do so before taking the wheelchair to the patient if they're going to be over the weight limit, because it's very embarrassing for them to try to get pushed by us in a wheelchair that they're not limited for, and it's breaking the wheels and so forth. You should also raise or lower the stretcher so that it is 12 inches lower than bed when you're transferring a patient to a stretcher. You should use that friction reducing device or mechanical lateral transfer device. You should always transfer the patient from their strong side first, or even apply an abdominal binder if the patient's abdomen is in the way. With mechanical lifts, they are used to transfer patients who cannot help themselves, who are too heavy for the staff to transfer. The slings within the mechanical lifts that we're going to use for those, it depends on the type of sling you use, on the type of patient or the size of the patient as well. You should follow agency policies and the manufacturer's instructions for washing the slings, and also agency policies for handling and washing contaminated slings in between patients. There's a good chance a sling's going to stay with a patient until they leave the hospital, or potentially even be thrown away after they leave. Before using a mechanical lift, you should be trained in its use. It must work. The sling, the straps, the hooks, and the chains must be in good repair. At least 2 staff members are needed for a mechanical lift, and the person's weight must not exceed the lift's capacity. You should always, always, always follow the manufacturer's instructions. And that's important to say because each facility is going to have a different type of mechanical lift. So next up is going to be pictures showing you how to use mechanical lift and how to put a sling on a patient. So you cross it underneath their legs and over into the lift, and then we'll raise them up and raise them down, and we will get practice with this next week in the lab. Next on, we are going to move on to chapter 21. Chapter 21 is the patient's unit or the person's unit. What do you think we're going to be talking about? Yeah, that's right. This is going to be their room and so forth. So this is not a very long one either. So chapter 21, the patient's unit. The patient's unit or room is going to be their personal space. It's their personal space for furniture, equipment, or even things provided by the agency. This is a very private area for them, and the patient and the resident's rooms are designed to provide comfort, safety, and privacy. The temperature and ventilation in the room. Most healthy people are going to be comfortable when the temperature in the room is 68 to 74. I will tell you that the elderly patients and ill patients may need higher temperatures. You should also protect infants, older patients, and those who are ill from drafts. Drafts are going to be like when the air flows in our room and it's coming straight down on you. You should have them wear the correct clothing, have them wear enough clothing, offer them lap robes or warm blankets, and you can cover them in bath blankets when giving care and move them from those drafty areas. Odors can occur in healthcare settings and in home care. Oh, this is a big one. These come from bowel movements, urine, draining wounds, and vomit, which all have embarrassing odors. Also, bodies, breath, and smoking odors may offend others. Smoke odors also present special problems. Residents, visitors, and staff smoke only in areas allowed, and typically that is not on any of the property of the facility. If you smoke, you should follow the agency's policy, and you should practice hand washing after handling the smoking materials and before giving care. If you smoke, please give careful attention to your uniforms, your hair, and your breath because it is there at all times. Good nursing care, though, includes ventilation and housekeeping practices to help prevent odors. So guess what? We're housekeeping too. We're not just anybody. We're going to do the role of many different people. Noise. Keeping noise to a comfortable level. CMS says that a comfortable sound level should not interfere with a patient's hearing. It should promote privacy when privacy is desired and allow the patient to take care or to take part in social activities. A common healthcare sounds may disturb some patients and residents, so like loud talking and laughter in the hallways and at the nurse's station are common, and they ask for us to keep this down. People want to know the cause and the meaning of new sounds. Healthcare agencies are designed to reduce noise. There should be window coverings, carpets, and acoustic tiles in the ceiling to absorb these noise. To also decrease noise, you should control your voice, handle equipment correctly, keep equipment in good working order, answer phones, call lights, and intercoms promptly. Lighting. According to CMS, comfortable lighting must lessen glare, let the person control the intensity, location, and direction of the light, and it lets the visually impaired person maintain or increase independent functioning with the proper lighting. Good lighting is also needed for safety and comfort as well, and you should adjust the lighting to meet the patient's needs. Another thing that you can do, if possible, is always keep the light controls within the patient's reach. This protects their personal choice of the lights. Older patients with dementia may be agitated or aggressive behaviors. Lighting control can be helpful in these scenarios, so soft, non-glare lights can be comforting. Room furniture and equipment. Rooms are going to be furnished and equipped to meet basic needs. The right to privacy is considered. The beds that they have could have electrical or manual controls. They should be raised horizontally to give care. Okay. The lowest horizontal position allows the person to get out of bed with ease, and that's what we always have to leave it in. The head of the bed is usually flat or raised to a varying degree. This is Fowler's, remember, was 90 degrees. High Fowler's is 60 to 90 degrees. Fowler's could also be at that top at that 90th degrees. Fowler's itself is going to be more of a 45 to 60 degree angle. Electric beds is where the controls are on the side panel of the bed rail or the footboard. So those are just like our beds. Those are considered electric beds. Patients and residents should be taught how to use the controls safely. Manual beds, which I haven't seen any of these in a long time, but who knows, it could be our year for this. Manual beds have cranks at the foot of the bed, and the cranks are up for use and down at all other times. The 6 bed positions are flat, Fowler's position, high Fowler's position, semi-Fowler's position, Trendelenburg's position, and reverse Trendelenburg's position. So flat, of course the bed is flat. Fowler's position is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Semi-Fowler's is 30 degrees. Trendelenburg's is where the head of the bed is actually lower than the feet. So the feet are up here, the head is lower. This is going to be used in scenarios like the patient is in shock, or if we have, and we're trying to raise their blood pressure, or if a patient we can see a baby crowning or something like that, then we're going to actually put mommy in Trendelenburg's position if she's in shock or something like that, and trying to use gravity to help keep the baby in. Now, there's also reverse Trendelenburg's, and this is where the head of the bed is raised and the foot of the bed is lowered. This is going to be pictures of the beds in those positions. And continuing on here in room furniture and equipment. The bed safety involves the whole hospital bed system. The FDA, or the Federal Drug Administration, defines the hospital bed system as the bed frame and its parts, which include the mattress, the bed rails, the head and footboards, and the bed attachments. Also, a person could get caught, trapped, or entangled in spaces created by bed rails, the mattress, the bed frame, and the headboard and footboard. Serious injuries and deaths have occurred from head, neck, and chest entrapment. Arm and leg entrapment can also occur, so please be cautious with these. Patients at greatest risk for equipment failure or entrapment are going to be the elderly, the frail, the confused or disoriented, the patients that are restless, the patients that have uncontrolled body movements, have poor muscle control, are small, or are restrained. Hospital beds have 7 different entrapment zones, zone 1 through 7. And so you can go ahead and go through those and look through those on your own on this slide. Also, in the room should be an over-the-bed table or a bedside table. It can be moved over the bed by sliding the base under the bed. It is raised and lowered for the person in the bed or in the chair. It is used for meals, writing, reading, and other activities as well. The nursing team uses the overbed table as a work area as well. You should only place clean and sterile items on the table. Nothing is more gross than seeing a urinal or products with poop on them sitting on that bedside table, because that's the same bedside table that they eat on. So please do not place that on there. Never place bedpans, urinals, or soiled linen on the over-the-bed table. So next is going to be a picture of that over-the-bed table as well as a bedside stand. The bedside stand are going to be used to store their personal items or personal equipment as well. The patient's unit or the room, again, is used for personal and visitor use. It is also our job when we go in for the day to also clean up and pick up their space to keep it comfortable, sturdy, and everything like that. The person's unit should have a privacy curtain as well that extends around the bed. And always pull the curtain completely around the bed before giving any care. Remember, privacy curtains do not block out sounds or noises, and to keep HIPAA in your mind at all times. Personal care items include are things for hygiene and elimination. So the agency is going to provide something like a bedpan or urinal, a wash basin, a kidney basin, a water pitcher and cup, a soap in the soap dish, and some patients even bring their own personal care products. The call-light system. This is a system that lets the person or patient signal for help. When using the intercom system, remember confidentiality. The patients with limited hand mobility may need a call-light that is turned on by tapping it with a hand or fist. Some people cannot use call-lights. Check the care plan for special communication measures and check these patients often. You must keep the call-light within the patient's reach, place the call-light on the patient's strong side, remind the person to use it, and answer those call-lights properly. Also, there should be a call-light or a call-light with a pull cord in the showers or the bathtub rooms as well. In the bathroom, there should be a toilet, a sink, and a call system, and a mirror or standard equipment. Some bathrooms have higher toilets or raised toilet seats, and there are grab bars by the toilet for safety as well. Towel racks, toilet paper, soap, paper towel dispenser, and a wastebasket are placed within easy reach for the patient. Bathrooms also have call lights, as we discussed before. Also in patient rooms, there should be a closet or drawer space. OBRA and the CMS require that the nursing care centers provide each person with a closet space. The closet space must have shelves and have a clothes rack. The person must have free access to their own closet space. Items in the closet and drawers are the person's private property. You should remember that. You must have permission to open or search closets and drawers. The person's unit must be kept clean, neat, and safe and comfortable at all times. All right, this is the end of chapters 19, 20, and 21, and I hope you have a good day.